Hello everyone. The topic for today's presentation is rubber dam isolation and its advancements. These are the following content that needs to be covered for today's presentation. Isolation. It is used for good accessibility, visibility, adequate room for instrumentation. It is necessary for easy manipulation and insertion of restorative material. Goals of isolation: moisture control, retraction and access, harm prevention, safe and aseptic operating field, prevent accidental swallow of restorative materials and instruments, bacterial contamination from saliva, local anesthesia. Methods of isolation. There are two methods of isolation. One is indirect and the other is the direct method. The indirect methods comprises of comfortable position of the patient and relaxed surrounding. Number 2, local anesthesia. Number 3, drugs like anti-sialagogues, anti-anxiety drugs, muscle relaxants. The direct method of isolation comprises of rubber dam, cotton rolls, saliva ejectors, mouth props, gauze piece, gingival retraction cord, mouth mirror. Rubber dam. It was introduced by Sanford C. Barnum in 1864. It is one of the most effective means of isolating teeth. It ensures absolute moisture control in the mouth. It isolates one or more teeth that are to be worked upon from the rest of the mouth. Now, let's look in detail about the advantages and disadvantages of rubber dam. Advantages: dry, clean operating field, improved accessibility and visibility, improved properties of dental materials, protection to patients and operator, increased operator efficiency. Disadvantages: minor damage to marginal gingiva and cervical cementum during clamp removal. Metal crown margins show microscopic defects following clamp removal. Ceramic crowns could fracture if clamps are allowed to grip the margins. Difficulty in taking radiographs. Contraindications. It is contraindicated in partially erupted teeth, latex allergy, extremely malpositioned teeth, third molar teeth, asthma patient, psychological reasons like claustrophobia. Armamentarium of rubber dam. Rubber dam material, rubber dam frame, rubber dam clamp, rubber dam template, rubber dam clamp forceps, rubber dam punch, lubricant, wedges, and rubber dam napkin. The rubber dam material is available in two forms: latex and non-latex of size 5 into 5 inches and 6 into 6 inches. Colors available: black, blue, green and translucent. Two surfaces: shiny, which faces the tissue, and the dull, which faces the occlusal surface. Thickness. It is of various thickness from thin, medium, heavy, extra heavy and special heavy. Rubber dam frame. This holds the border of the rubber dam material, preventing it from falling into mouth. It is used to provide a clear operating field. It retracts the soft tissue and improves access. There are two types: plastic frame and stainless steel frame. Different plastic rubber dam frames available: Star T frame, hinged rubber dam frame, Star Visi frame, Nygaard Otspe frame. Now let's look in detail about each frames. Hinged rubber dam frame. A double hinge situated in vertical axis of the frame, which allows it to be folded in half in the vertical direction. Safe T frame. It is composed of two hinged frame members whose snap shut locking system mechanism securely clamps the rubber dam sheet in place. It also has further advantage of raised edges of the frame, which provides a barrier around the sheet, preventing fluids from escaping onto the patient. This contributes to greater patient comfort. It is made up of non-irritant such as polysulfone. These are the stainless steel rubber dam frames available: Fernald frame, Young's frame. Rubber dam retainer or clamp. Rubber dam retainer or clamp. The rubber dam retainer consists of 4 prongs and 2 jaws connected by a bow. It is used to anchor the dam to the most posterior tooth to be isolated. It is available in many sizes and shapes with specific retainer designed for certain teeth. 2 types of clamp, winged and wingless. The winged clamp has projection at the jaw while the wingless do not. Classification of clamp. Based on the material used, they are classified into metallic and plastic. The metallic are of 2 types, stainless steel and carbon steel. Based on bows, single bows and double bows. Here are the different clamps for specific teeth. Anterior tooth. Use double bowed clamp, that is number 9, number 212 SA. Premolar teeth. Use small flat jawed clamp, that is number 00, number 2, or curved jaw clamp, that is number 1. Molar teeth. Use flat jaw clamp, mandibular molars, that is number 3 and number 7. Use curved jaw clamp for maxillary molars such as number 8, number 4, number 56. Here are the few advancements of clamp. Silker's Glickman clamp, Cushy's rubber dam clamp cushions, fit cervical clamp. The Silker Glickman's clamp is with an anterior extension which allows for the retraction of the dam around the severely broken tooth. The clamp itself is placed on a tooth proximal to the one being treated. It is made from durable cast stainless steel which is autoclavable, corrosion resistant, flexible and long lasting. It is ideal clamp for molar isolation. Its extended wings allows the rubber dam placement around the teeth with minimal tooth structure. Few special clamps that are used in clinical practice. Partially erupted tooth clamp, special molar clamps, extended bow clamp. Rubber dam punch. A metal table that is rotating table with 6 holes of varying size and a tapered sharp pointed plunger which is used to produce clean cut holes in rubber dam sheet through which the teeth can be isolated. Types of rubber dam punch. Single punch, multiple punch. Single hole punch, Ainsworth, ivory pattern. Rubber dam forceps. Rubber dam forceps are needed to stretch the jaw of the clamp open in a controlled manner during placement and removal of clamp. These are the forceps. Brewers, Ash, University of Washington, ivory pattern. Rubber dam template or stamp. This helps in marking the dots on the sheet according to the position of the tooth. Holes in the rubber dam should be punched approximately over the center of the incisal or occlusal surface of the tooth to be engaged using a rubber dam template below the rubber dam sheet. Rubber dam napkin. It is a disposable paper which is placed between the patient's skin and the rubber dam sheet. It prevents the contact of the rubber dam sheet to the skin, thus preventing any possible allergic reaction. It absorbs saliva seeping through the corners of the mouth. It acts as a cushion. Dental floss. It helps the rubber dam to place in correct position, tight contact. It requires for testing the interdental contact of the rubber dam. Wedged cord. It is used to stabilize the interproximal area of the rubber dam. It is flexible elastic material that can be passed over the dam interproximally below the contact area. Modeling compound. Low fusing modeling compound is used to secure the clamp to the tooth to prevent movement of the clamp during operative procedure. Rubber dam lubricants. It is applied in the area of the punched hole that helps the rubber dam to pass through the proximal contact. It is commercially available, but other lubricants such as shaving cream or soap slurry is used. Steps in rubber dam application. Punching the hole in the rubber dam, testing and lubricating the proximal contact, clamp selection and its placement, then test its stability and retention, positioning the rubber dam and insert it inside the clamp, apply the napkin and attach the frame, passing the dam through the posterior contact and apply the compound, passing the septa through the contact with tape, inverting the dam interproximally and faciolingually, testing and lubricating the proximal contact, confirming a proper applied rubber dam. Isolation according to operation. To operate on the incisal and the mesial surface of the canine, rubber dam is placed from the first premolar of one quadrant to the first premolar of the other quadrant. To operate the canine, the rubber dam is placed from the first molar to the opposite lateral incisors. To operate the posterior teeth anteriorly, the rubber dam is placed to include the lateral incisors on the opposite side of the arch. To operate the premolar, 1 to 2 teeth distally and extend anteriorly to include the opposite rubber lateral incisors. To operate the molars, the rubber dam is placed far distally and extend anteriorly to include the opposite lateral incisors. For endodontic therapy, only the tooth that needs to be treated is isolated. Clamp placement. The lingual jaws of the clamp are applied first to the tooth surface. It is placed below the highest point on the lingual contour of the tooth, that is below the crest of the curvature, and same for the buccal contour. The clamp is then released from the forceps. It is ideal to place a floss with the clamp in order to avoid breakage of clamp or clamp swallowing or aspiration. Methods of rubber dam application. Dam first technique, clamp first technique, clamp and dam together technique, substitution of the retainer with a matrix, split dam technique. In rubber dam first technique, the rubber dam is placed followed by clamp placement to attain ideal isolation. In clamp first technique, the clamp is placed along with the rubber dam onto the tooth. In clamp and rubber dam technique, the clamp placement is done followed by the rubber dam placement to attain isolation. In situations where clamp is not present, a matrix is replaced in place of clamp. Split dam technique. Two overlapping holes are punched together. Rubber dam is stretched over the tooth to be treated and over one adjacent tooth on each side. The edge of the dam is carefully teased through the contact on the distal side of the adjacent tooth on both sides. Indication: partially erupted teeth, insufficient crown structure, single fixed processes, abutment tooth for bridge. Off-centered rubber dam causes obstruction of the nasal airway. Punched arch form small errors in rubber dam. Off-centered rubber dam leads to obstruction of the nasal airway. If the punched hole is small, it permits leakage. If the punched hole is large, it interferes with the axis. Removal of rubber dam. Cutting the septa, followed by removing the retainer, followed by removing the dam, wiping the lips, and rinsing the mouth and massaging the tissue. Here are the advancements of rubber dam. Derma dam, Insti dam, Opti dam, Flexi dam. Dry dam, Optra dam, Opal dam or liquid dam, Handy dam. Now let's look in detail about each advancement. Derma dam. The derma dam, it is a non-latex. Now let's look into each advancements. Derma dam. It is a non-latex and powder-free rubber dam which removes the possibility of latex reaction. It has a low content of surface proteins and has an advantage of having low dermatitis potential, reduced allergic reactions and greater tear resistance. The Flexi dam is an elastic non-latex dental dam made from an elastic elastomer and can be elongated more than 1000% before tearing. It is more tenacious than latex dam and is simple to place. It needs to be stretched before use. The punched hole should be 1 or 2 sizes smaller than normally used for latex dam. As the dam is non-latex and powder free, there are reduced chances of allergic reaction. It is available in blue and violet color. These colors provide a good contrast to the working area and may have a calming effect on the user. This is an advantage while performing aesthetic treatment procedures. Insti dam. It has an inbuilt flexible radiolucent nylon frame, eliminating the need for a separate one. It is made up of translucent natural latex that is very stretchable, tear resistant and provide easy visibility. There is an off-centered pre-punched hole which customizes fit to any quadrant. More holes can be added if desired. Its compact design is used just right to fit outside the patient's lip. It has the following advantage. Built-in flexible frame which eliminates the use of separate frame. Pre-punched hole. Radiographs may be taken by bending the frame without removing the dam. Minimal pull on clamp. Single use and hence eliminates the need of sterilization. Handy dam. It is a pre-framed rubber dam which eliminates the need of the traditional frames. It is quick and easy to place. It allows easy access to the oral cavity during root canal treatment. Dry dam. It is an alternative type of rubber dam which does not require a frame. It consists of a small rubber sheet set in a center of an absorbent paper with light elastics on either side to pass over the ears. It fits like a face mask with an absorbent lining to give patient comfort and reduce risk of allergic reaction. It is available in medium and thin varieties. It has an added disadvantage of not helping or useful in a bleaching procedure due to the absorbent nature of the paper surrounding it. OptiDam is the first rubber dam with three-dimensional shape. The three-dimensional shape of the OptiDam and the anatomical frame shape match the contour of the mouth. This allows greater access and improved visibility to the working area. This also allows reduced tension resulting in easier rubber dam application and low risk of clamp displacement. OptiDam is available in two versions, anterior and posterior. It requires less preparatory work than the conventional rubber dam. It offers maximum patient comfort and allows them to breathe with no pressure around the nasal area. OptaDam represents the next generation of rubber dam, combining the benefits of lip and cheek retractor with a total isolation of the rubber dam. The anatomical shape, high flexibility and patented inner ring design allows it to be placed without the need of clamp. Additionally, there is no need for separate rubber dam frame, making it more time and cost efficient. The soft flexible material allows the patient to maintain full mobility of the jaw along with added comfort throughout the procedure. References. Hope you enjoyed the presentation. Thank you.